Hey everyone, welcome to Livestock and Poultry Healthcare ASC 301. This is Harini.V, BSc Agriculture 3rd year student. Under the guidance of Dr. S.Y. Mukherjee, the topic assigned for me to present are auscultation of lungs and heart, recording of pulse, and blood collection. So let's see what is auscultation. Auscultation is the term used for listening to the internal sounds of the body, usually using a stethoscope. It is performed for the purpose of examining the circulatory system and respiratory system, that is, the heart sounds and the breath sounds. It can be also used for gastrointestinal sounds like bowel sounds. Auscultation of lungs. The bovine lung field is relatively small. Breath sounds can be heard in a triangle formed by the triceps cranially, the attachment of ribs to the vertebral column dorsally, and an imaginary line joining the point of elbow with the 11th intercostal space. Lung sounds are loudest in the mid-thorax region. Normal respiratory rates of ruminants are very similar. Cattle 18 to 35 beats per minute, calf 20 to 40, goat 15 to 30, kid 20 to 40, sheep 12 to 20. Some of the abnormal sounds heard are crackles, wheezes, and bronchial sounds. Bronchial sounds like tracheal sounds only, but not as loud. Crackles are discontinuous sounds because their intensity fluctuates. Wheezes are created by narrowing of airways. Auscultation of heart. Heart sounds are best heard under the triceps or elbow between the 3rd and 5th intercostal spaces on the left side, but can be heard on the right side also. The normal rate is 15 to 80 beats per minute. The points to be noted here are rate, rhythm, intensity, and quality of sounds, and whether abnormal sounds are present. Normal rhythm is heard in 3 time and can be described as lub, dub, and pause. Recording of pulse. Pulse means beating of arteries due to beating of the heart. The pulse should be taken at the middle coccygeal or facial arteries in cattle and the femoral artery in sheep and goats. Ball of the finger should be used and not the fingertip. With careful palpation, a number of characters may be determined, including rate, rhythm, amplitude, tone, maximum and minimum pulse pressures, and form of the arterial pulse. Small-sized animals, younger animals, and in females, standing posture will have higher pulse than their counterpart. Types of abnormal pulses. Slow, weak, or soft pulses in case of Wolff stenosis, toxemia, and septicemia. Irregular pulse in case of pneumonia. Intermittent pulse in myocarditis. Unequal pulse in defective stroke volume. Jugular pulse in TRP. Bradycardia is slowing of the heartbeat. Tachycardia is increased pulse rate. Collection of blood. Materials used as disposable gloves, halters, clippers, needle, antiseptic, gauze, sharp containers, biohazard box for syringes. Consideration. Ensure that the animal is properly restrained to avoid the injury to the animal. Blood can be collected from the jugular vein in cattle. Allow the animal some time to adjust to their restraint before beginning. Operators should use gloves and disinfect them. Equipment such as VACUTAINER holders must be cleaned. Use a fresh needle for each animal. Use clean gloves to prevent the transmission of bloodborne diseases. Use a fresh bleeding needle with every cow. There are mainly 4 procedures for collection of blood. Jugular venipuncture using VACUTAINER needle and tubes. Jugular venipuncture using syringe and needle. Jugular venipuncture using bleeding tubes. COCCYGEAL venipuncture using VACUTAINER needle and tubes. Thank you for watching till the end. If you like it, please give a thumbs up.